Okay, now let's cover to-rescuer adult CPR for the healthcare professional. There's a couple nuances that I'm going to talk about here, and that is the fact that when you have a second rescuer who's fully trained and knows how to help, we can now share the responsibilities instead of a single rescuer doing everything. But regardless of whether they have a simple face shield with a one-way valve or a full bag valve mask, whether it's attached to oxygen or not, it doesn't matter. We have the capability of sharing these responsibilities so that we don't get as tired when we're doing these compressions and rescue breaths. So we're going to show you now that it's going to look very similar to a single rescuer in the assessment phase, but then once we actually do the skills of CPR compressions to rescue breaths, you're going to see how we share those responsibilities and how we coordinate a switch between the compressors so that no one is doing more than 2 minutes of CPR compressions at any one given time without a rest. So let's see how that looks. So we're going to take it that our patient is here lying on the floor, the scene is safe, our gloves are on, and we have a bag valve mask in this situation to do rescue breathing. We call out to the patient, "Are you all right, sir? Are you okay?" They don't respond. Hand on the forehead, tap on the collarbone. "Sir, can you hear me?" They don't respond. We're going to activate a code, call 911, or call EMS. Now that that's done, we're going to go ahead and get right into our assessment and check for normal breathing. I check for a carotid pulse during that same time for no more than 10 seconds. Jody, this person is not breathing normally and they don't have a pulse. I'm going to begin CPR. If you could take the rescue breathing. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Notice how Jody reassured that there's a good aggressive head tilt chin lift. He now uses the CE form of sealing the mask to the patient's face as he draws the chin up into the mask and now with a good seal delivers 2 rescue breaths. First breath, chest rises and falls. Second breath, chest rises and falls, and I go right back into my 30 compressions. We are going to continue this 30 compression to 2 rescue breaths for 2 minutes. After those 2 minutes, we're going to call out a switch, and after he delivers, after my 30 compressions, 2 more rescue breaths, he's going to go ahead and walk around and begin his chest compressions as I get ready to do rescue breaths with the bag valve mask. And this is what it looks like.
1 and 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Breath. Breath.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And we would do this again for another 2 minutes, and then we would call a switch again, at which point I give the bag valve mask back to my partner. I come back around and prepare for the chest compressions. We would do this cycle of 2-person CPR until an AED arrives, EMS or other definitive help arrives, or the patient begins to revive and begins breathing normally on their own.